This world of endoscopic spine surgery is really growing, and a lot of that has to do with better tools, but also a better understanding of what we're actually treating. And so the first thing that's really kind of blown up or grown is just back pain. And so it used to be that, for back pain, we would do fusions with screws or biologics or perhaps disc replacements or after we had done physical therapy, or we do injections and then burn the nerves that were kind of causing the pain. But now with this endoscopic surgery, we can actually identify preoperatively where we think the pain generators are coming from. And if we've done that successfully, we can go in there and find the nerves that innervate the joints that are painful, and we can clip those nerves or segment those nerves so that then the pain is gone for these patients. And so in the world of just low back pain, endoscopic spine has really kind of revolutionized that. And to do a large incision or a large open approach to kind of clip these small nerves would be very traumatic and not without risk or difficulty. But again, because I'm able to laser, very specifically target the area of interest that I know where the pain is coming from once I've diagnosed that up in the clinic or preoperatively, I can target that and then find that nerve and clip, 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 and then the recovery is much quicker for those patients, and the back pain is alleviated, and then we kind of move on. So that's number one. So the world of just back pain, we're kind of making some real big advancements and some improvements in how we care for these patients. The second thing is soft tissue disc herniations. So, classically these happen in younger patients. I was in the service for a long time, and we saw a lot of 20-year-olds and 30-year-olds with these large soft tissue disc herniations. And so classically those produce sciatica for these patients, pain going down one or both legs. And we would have to make an open incision, go in there and pull that disc out and get the pressure off the nerve. But again, with this endoscopic surgery, we can very specifically target that area, move the nerve aside, and then grab that piece of disc and pull it out, all through a very, very small tube. And so the soft tissue disc herniations in the younger patient population, sometimes in the older patient population, but classically younger, very, very successful for soft tissue disc herniations. And then I think the third area where this has really advanced or kind of helped us is in the older patient population. Sometimes those patients will have like a slip disc, or they'll have a little bit of a curvy spine, the scoliosis. And with that scoliosis or curvy spine, a lot of times you'll get some bony impingement. So that is to say, like the bone will perhaps be a little overgrown, or because the spine is bent, the nerve will be getting pinched because of that. And classically, we would have to fuse that spine or put screws in and straighten it and open it to get the pressure off the nerves where we need it. But now with endoscopic, we can use a burr or a device that kind of cleans some of that bone off of the nerve. And again, very specifically. So if I know that the L2 nerve is being affected and it's from bony impingement from the scoliosis or curvy spine, like pinching that nerve, then I can go in there and find that nerve with the camera through a small tube, kind of clean it off with the bone, and then the nerve pain is better. And so we've avoided having to do a larger surgery for somebody that has significant pain. So I think the low back world, I think the soft tissue disc herniations, and then I think for some of these older patients in the degenerative scoliosis world where they have bony impingement, I think it can be a game changer for them too.